Friends, today we will see an algorithmic approach to the diagnosis of heartburn. A 52-year-old laboratory technician is brought to the emergency room with acute chest pain and pain on swallowing. He gives a long history of heartburn relieved by antacids. Following the algorithm, you administer nitroglycerin without relief. The heartburn is associated with regurgitation, so you administer a GI cocktail which includes lidocaine viscous and his pain is relieved. You suspect reflux esophagitis and your diagnosis is confirmed by esophageal pH monitoring and esophagoscopy. So whenever a patient with heartburn presents, we have to ask the following questions. Number 1, is there frequent regurgitation? If there is frequent regurgitation, the most likely diagnosis is reflux esophagitis and hiatal hernia. Gastritis and a previous gastrectomy will also cause frequent regurgitation. Is there recurrent nausea or vomiting? If there is recurrent nausea or vomiting, the most likely diagnosis is cholecystitis and cholelithiasis. Chronic pancreatitis can cause the same symptoms, however. Is the heartburn precipitated by exercise or relieved by nitroglycerin? These findings should suggest coronary insufficiency. Is there associated hematemesis or recurrent black stool? The presence of hematemesis or recurrent black stools should suggest a peptic ulcer. Is there relief with any local anesthetic containing antacids? The relief of the pain on viscous lidocaine suggests reflux esophagitis, hiatal hernia, and previous gastrectomy with bile esophagitis. Gastritis is not usually relieved by viscous xylocaine. So the diagnostic workup should be ordered according to the suspicion of the diagnosis. The workup begins with an upper GI series, an esophagogram, and stools for the occult blood. If this study is negative, it may be prudent to give the patient a trial of proton pump inhibitor. If there is recurrent vomiting and right upper quadrant pain, a gallbladder ultrasound or cholecystogram should be done. If these are negative, it is best to refer the patient to a gastroenterologist for esophagoscopy and gastroscopy. The gastroenterologist may do a Bernstein test which will reproduce symptoms of an infusion of dilute hydrochloric acid into the distal esophagus or perform esophageal manometry or pH monitoring of the distal esophagus. An exercise tolerance test and coronary angiography also have their place in the diagnostic armamentarium. A breath test or a stool for Helicobacter pylori antigen should be ordered in persistent cases. So this is the algorithmic approach for the diagnosis of heartburn. Thank you.